what are the effects of the devices, and I think also do different devices affect differently in your perception. Today we have come for our annual eye checkups at the Hospital of Suleiman Al Habib here in Buraida. It's one of the largest hospitals for tertiary care and for the private healthcare system. So we're going to take you inside and show you an example of how it works in the private system. So today we are visiting the healthcare system in Saudi Arabia, and I wanted to tell you a little bit about how the healthcare system is here in Saudi Arabia, how it's delivered, how much it costs, all of these things. And so this is our video plan for the day. So we have come to Suleiman Al Habib Hospital. This is a private hospital in Buraida. And here you have all of the different specialties. This is called a tertiary hospital because it has emergency room, urgent care, and all of the outpatient clinics of all different kinds. So this is the first thing. Now, the whole entire system in Saudi Arabia is run by the Ministry of Health. And Ministry of Health is the government organization that coordinates and funds all of the healthcare. Now, in the system, this public health, it is public domain. So in the public system, they have primary healthcare centers, secondary healthcare, and tertiary centers for the more advanced technology and surgeries and things like this. In the primary healthcare centers, these are located in each of the neighborhoods. They're small buildings, and there you can receive the basic screenings, you receive the children's vaccines, there's dentistry there, there's general medicine. So if you are having any sort of symptoms, you can go there first, and then they will screen you and give some basic testing. After that, they will refer you to a secondary or tertiary center, depending on the problem, and then you will see the specialist. So the public healthcare system that is run by Ministry of Health, this accounts for the majority of the system, and this is paid for, and all Saudi citizens are eligible for this system, as well as anyone who is working for a governmental agency. So in that system, the healthcare is delivered for free for the most part. Now, the second system that is here in Saudi Arabia, and it is developing and getting larger, is the private healthcare system. Now, in the private healthcare, usually it's private clinics or outpatient clinics or private big hospitals. And here you need to use some type of insurance. So when you come to Saudi Arabia and you work for a private company, as we do, then your company will give you the health insurance. They will pay for your health insurance, and then you have your card. You can seek medical treatment of any kind at the private healthcare system. So these are the two methods going on in Saudi Arabia to get your health care. If you see down this wing, we have bariatric clinics, and also this new building is decorated with a lot of gorgeous artwork. So you can see some of these beautiful paintings on the walls here. Well, we want to introduce Dr. Sally. She has been our eye doctor for 6 years now. We look forward to coming and seeing her every year, and she's very good with the children. So I want to just say, first of all, thank you so much. And how long have you been living in Al Qasim?
Qasim, more than 10 years, actually.
Wow.
Yeah, around 12 years.
12 years. So I think we came at the same time, because we also came in 2013.
Exactly, the same.
And you have been working in Al Habib this whole time?
10 years exactly.
Okay.
Now I will finish 10 years.
Mashallah, mashallah. So your practice, is it focused mostly on the children, or what is the, okay, tell,
From
what are your,
3 years,
okay,
I can see from 3 years old until whatever ages,
adults.
adults and yeah, old.
So what proportion are kids and what proportion are adults? More kids or more adults?
Mix, yeah.
Mix.
I can't say percentage for kids or adults because all,
All are coming,
yeah,
okay.
mix.
Okay, so what parents really want to know is what is your observation of the kids' eyes? Are they changing over time? What kind of problems you're seeing in the kids? And how much you think these devices and mobiles are
Affect.
affecting?
Yeah, it
Just
affects-
your clinical perception.
Actually, there is a high percentage of affect all the instruments, all these technologies on their eyes, especially for the kids, like from 3 to 13 years old. First, I'm advising not to use continuously more than half an hour.
Okay,
We can use half an hour and let the eye relax for 3 to 4 hours. After that, we can take another half an hour, no problem. Right eye first, 1 or 2. Sure. This one. And 1 or 2. The total watching mobile for kids from 3 years to 7 years, maximum 1 hour, and we need to divide
okay.
the 1 hour not continuously. From 8 years to 13, 14s, it's okay to use it for 2 hours maximum, but also not continuously. We need to use half an hour,
Yeah. Break.
break half an hour. Actually, the devices who will use it and sit far away much better than the devices who will put it too close from the eyes.
Right, right.
And darkness, we do not advise any setting darkness and illumination very high. We prefer normal lights with a normal also illumination of the mobile.
I just wanted to have you comment specifically, because you're saying emphasis should be on time limits and taking the break, so to remove the pressure from the eye.
Exactly.
That's what I'm understanding. Second thing is you're saying smartphone is the worst for the eyes.
Exactly.
Because of the distance and because of the type of light.
Exactly.
Okay, so if we can try to put our kids on larger screens that are farther away, then they better for the eye health.
Because also not only affect on the eye, like giving refractive error, also affect a dryness.
Yeah, this was my next question actually. Are you seeing new types of eye problems, or just the severity is getting worse?
No, it refractive errors,
Okay.
dryness. If we will go out of not only on the eyes, really it affects too much on the kids' concentration. The concentration become less.
In your clinic, in your children, or community at large?
Actually, in community, I can recognize it with my kids in the home. If they catch the phones and I try to talk to any one of them, they will
Not hear you.
Exactly.
Yeah, I think
They
every
can
mother
see.
feeling this, yeah.
I ask many of the mothers come to my clinic.
Yeah.
They tell me the same.
Yeah, this is a major public health problem.
Yeah. They
Yeah.
can't see. They can't hear. They will never concentrate with us. If they close, I remove it. They become normal.
Right, right.
Isn't that?
Yeah, same. I have
You
same experience.
You can touch it
Yeah.
with them.
I recall one time, maybe 1 year back when we were here, you were telling me though you had a patient where the vision problem was not something you had seen before. Maybe her lens was like wavy, or it was like a new eye problem that are you seeing any new types of eye problems in the recent
Actually-
times?
Actually, it's the same refractive errors,
Okay.
but we can see how much it increased.
Right.
These problems increase in the last 3 years,
Okay.
especially if there is online schools, and if they finish online schools, they go to use it for playing, watching the
Yeah.
social media. They will continuously use it. Many of the families come to me, they say it's okay, they use it for like 8 hours or 12 hours continuously without stop.
Yeah.
If they finish from the mobile, or the mobile charge of mobile finish, they go to PlayStation.
So today we have checked in for our appointment, and I just want to tell you a little bit about the cost. So today we are seeing like a pediatrician, and the cost for the consultation is 51 Rial. This is approximately $12. We can calculate it. Also, we came the other day for seeing the optometrist. That consultation was 41 Rial, Saudi Rial, per child. My children wear glasses, so we all saw the optometrist. This is also around $10 or $11. So basically the point is, in the private healthcare system, it's very affordable because your insurance will cover most of the costs for consultations and even for the surgeries and other things. In the public system, most of the services are delivered for free and paid for free to the population and paid for by the government. Okay, so another important aspect of healthcare is childbirth. Now, I have 4 kids, and 3 of them are born here in Saudi Arabia, and I went to a private hospital for this. It was an absolutely excellent experience. I have very good things to say about it. In the private system, it was gender segregated, so all of the nurses are female and all of the OB-GYNs were also female, and I just felt very well taken care of. I went directly in, and the nurse is with you the whole entire time, and the deliveries were smooth, and recovery is pretty short. They don't keep you here. Actually, when my first son was born here in 2014, at that time they would allow you to stay a couple of days in the hospital, I think like 2 days. But by the time my daughter was born in 2021, they had shortened this period down. So they just give you 24 hours after the delivery. So it kind of depends on what time of day you enter, how long you stay in the hospital after. But the aftercare is also very good. The interesting thing though about the system that's really different than Western countries is that because it's gender segregated, your husband or any other male relatives do not enter that area with you. And so since our family is here, I went by myself and did it. So it was a really different experience than having births in US system.